Well, I'm going to switch completely. I'm the person who's here for 6 minutes to convince you that health technology is a good thing and that it can actually reduce your stress. I have two areas of academic interest as a psychiatrist. The first is on health technologies, and the second is on physician health. You wouldn't think naturally that those two overlap, but I've actually written 2 books that have been published fairly recently, both of which in fact look at the combination area of these 2 issues and how you can use health technology intelligently to actually improve your life. If there's one thing you remember from what I'm going to say in this 6 minutes, remember that almost every weekend I have a 3-day weekend and I work from home. So that's really important, guys, okay? If we start off very briefly, how many people actually see patients on video in their practices? So just a very few, okay? Any of you actually see patients from your homes? So there's 3 of us in the room see patients from our homes now, but we have the flexibility to actually change the way we work and to control our lives much better. I guess if I have one aim overall, it's that you all know the triple aim, the sort of better health, better care, lower costs. My view is that we should have a 4th aim to that, and that is better clinician wellness. And there's a sort of move now going around the country to try and actually get this put into sort of national policy processes. And I think it's very realistic. We know that over 50% of US physicians experience some sign of burnout, and we know that 80% of burnout is basically organizationally related. Okay, it's caused by somebody else. Okay, so you cannot literally resilience yourself out of burnout. Okay, you can improve yourself a little bit, but you can't just sort of go and be terribly mindful and everything will be fine. Okay, you've got to look at the organizational issues. So one way of looking at the organizational issues is to change the way you practice. Now I'm an academic. This is actually my room at UC Davis, my consulting room, and so you'll see it's a bit untidy. But you'll also see here that I actually see patients both in person and online in this room. So you see I've got 3 screens on my desk, but I also have chairs in the traditional sort of psychiatrist room. Most of the patients I see nowadays are actually physicians. And when a patient is referred to me, they get the choice of do they want to come and see me in person, or do they want to see me from their homes, or do they want to do a bit of both, which is in fact what a lot of people do. They sometimes come and see me, sometimes see me from work or from home. So that's clearly much better for patients. This is the simple setup. It's the 3-screen setup. This is not a patient that I'm looking at for HIPAA reasons. This is one of our staff. But basically, I see the patients on video. I have the EMR on one side of me, and I have other notes, or I have some messaging systems, or the internet, whatever I want on the 3rd screen. And as I'm seeing the patient, I type my notes, so it's actually a much more efficient process. I don't ever write notes at night. I get my notes finished when I'm seeing my patients at the time of the consultation. So that's the way that I practice, and that's the way that certainly the UC Davis Psych Clinic we're now routinely practicing, and we're training all our residents to work in exactly this way, this hybrid approach to care. Now, what I do a bit differently is this is actually our second home on the Monterey Peninsula. And I go there on a Thursday afternoon or evening, and I have a nice study set up there, and I work from there on Fridays. And I see patients from there, and I have meetings there. And I promise you, it is so much nicer working from home. Okay? It is so much more civilized. Okay? And effectively, it means that I have almost a routine 3-day weekend now. And quite honestly, if you want to improve your lifestyle, feel better about everything, that's a great way of going. Now, I genuinely do sort of walk the talk, because my primary care physician actually does some similar things. He's Peter Ash at Kaiser, and Kaiser has been fantastic about this in terms of getting video visits. So here you see Peter and I having a consultation, and I'm a patient in this setting. And so I log in and see Peter on video, as long as I don't need a physical, and have my normal consults like that. So I'm going to just skip that one slide. look at the advantages of seeing patients on video. Okay? There are many of them. I've got 7 major areas. The first is quality. We know that the quality of care is as good as in-person care. There's been tons of research to show that, and that as long as you're not actually actively doing surgery, you can basically do almost any other sort of medical sort of consultation style. We know that in fact it saves you time, because you can write your notes as you're seeing the patients in a socially acceptable way, still getting eye contact with them. And there's a surprising amount of time actually saved in the whole rooming process that occurs in most clinics. We know that for physicians it gives you much more flexibility, independence and control, because you literally can choose your work style, your place, your timing, and you're no longer such a 9 to 5 person. You can become, if you want to work Saturday mornings and take Wednesday afternoons off or whatever it is, that's totally fine. So one of the groups of patients I see from my home are actually patients in nursing homes. And so I don't travel to nursing homes, I just see them all on video from my home down in Monterey. We know that cost-wise it's cheaper. The technology is so cheap nowadays, you can do this on an iPad. And we make significant savings in admin time at UC Davis in the clinic that we work in, because essentially you don't have to have all that interpersonal work done, but does take time and effort. Variety is fantastic. You can work at lots of different places. You're not actually stuck working only for one employer. You can work for several employers, potentially, or you can just run your own practice from your home. And so you get much more variety. The teamwork is fantastic. Again, I work routinely with local providers, been into primary care clinics, into nursing homes. I get to know the people in those places without necessarily having to visit. And we know that safety is also a very important advantage, particularly in the correctional system, where it's been well shown that in fact physicians providing care in corrections using video actually feel safer and provide better care than people who are in person. So go and have a virtual hug and join the telemedicine crowd. Thank you.